All right, so ready to dive into something really important today. We're going deep on how nurses handle medications, like the whole process. It's way more involved than you might think and super crucial to making sure the medications you get are, well, safe and that they actually work.
Yeah, definitely more than just handing someone a pill.
Exactly. I mean, modern healthcare, it's just so complex these days. We've got more older folks, people juggling multiple health problems. Then you add in all the new drugs and technologies, and patients who are much more informed and involved in their care. It's a lot.
It really is a constantly changing landscape.
But at the core of it all, is nursing. It's this incredible blend of like genuine care and serious science. You need chemistry, anatomy, physiology, and of course pharmacology. That's how drugs actually work in the body.
Yeah.
And those scientific bits are constantly changing, so nurses are always learning, always keeping up with the newest stuff about drug therapy.
And what really distinguishes nursing, I think, is that holistic approach. Nurses are looking at you as a whole person. It's not just about your physical symptoms, it's your emotional well-being, your understanding of what's going on, your social situation, culture, even your beliefs. All of that feeds into how they approach your care, including your medications.
Makes sense. So a nurse isn't just there to administer a drug, right?
Yeah.
They're assessing you, figuring out the best way to give you the medication, teaching you how to handle it, and then constantly checking to see if it's working, if there are any issues. They're also communicating with the doctors, pharmacists, everyone to make sure everything's running smoothly.
It's a real team effort, and the framework that guides all of this, the foundation, is what we call the nursing process. It's this systematic way of approaching care, a step-by-step problem-solving process. It's got 5 main components: assessment, coming up with a nursing conclusion based on that assessment, planning the care, putting that plan into action, which is intervention, and then constantly evaluating how things are going. When this process is applied to medication, well, that's how we ensure that the care you're getting is safe, effective, tailored to you, and based on solid evidence.
Perfect. So let's start with that first step, the assessment. When a nurse is focused on medication, what exactly are they assessing?
It's all about gathering information, getting your unique story. It's a really organized way of collecting data about the patient. And as we've mentioned, it's not just about your physical symptoms. We're also considering your intellectual capacity, emotional state, social situation, culture, even your home environment. We want to get a really clear picture of you as a whole person. And it's important to remember that assessment, it's not a one-time thing. It's an ongoing process that evolves as your health changes.
So when it comes to medication specifically, what are the key areas a nurse would zero in on during that assessment?
There are 2 main areas: your past medical history and, of course, a physical exam. Let's start with your history. That's really key because anything you've experienced before, any past illnesses, it can all impact how a medication affects you now. This information is vital for using medications safely, effectively, and, avoiding potential problems like side effects, bad interactions with other things you might be taking, and even just straight up errors in your medication plan.
Okay, so what kind of things in a patient's history are especially important when it comes to medication?
Well, chronic conditions are a big one. Things like kidney disease, heart disease, diabetes, lung problems, these can all change how your body actually handles medication, how it absorbs it, breaks it down, gets rid of, that's what we call pharmacokinetics. It also affects how the drug actually works in your body, what we call pharmacodynamics. So for instance, someone with kidney disease, they might not be able to clear a drug from their system as effectively, so a normal dose could build up and become toxic. It might even mean certain drugs are completely off the table for them.
Makes sense. So chronic conditions are definitely something to consider carefully. What about other medications the patient might be taking? Is that also a big factor?
Oh, absolutely. Huge. That's where we talk about medication reconciliation. This is basically creating a complete, accurate list of every single medication you're taking, and I mean everything. Prescriptions, over-the-counter stuff, vitamins, herbal remedies, everything. We need to know the dose, how you take it, and even when you last took it. We do this when you're admitted to the hospital, when you're discharged, transferred, even during outpatient visits.
And why is it so important to have this complete picture? It seems like a lot of work to track every single thing.
It is, but it's crucial because so many things can interact with medications. Over-the-counter drugs, herbal remedies, stuff you wouldn't even think about, like alcohol or caffeine, they can all change how a drug works in your body. People often don't think of things you buy without a prescription as real drugs. They might forget to mention supplements or vitamins. That's why nurses have to ask very specific questions instead of just saying, "Are you taking any other medications?" They might ask, "Do you take anything for headaches, for pain, for sleep, anything you buy at the pharmacy?" Or, What about vitamins, herbs, supplements?
That makes sense. You don't want to make assumptions about what people consider medication. And what about allergies? Those are obviously a big deal, right?
Right, absolutely. Knowing about any past allergies is really important. A past exposure to a drug or even things like food or latex, it can trigger a reaction later on. And we need specific details like what exactly happened. Was it just a rash? Did you have trouble breathing? This helps us figure out how serious the allergy is and tell the difference between a true allergic reaction and a side effect, which is usually less serious.
And I know you mentioned earlier that it's not just about physical health history, right?
Okay.
How do those intellectual and emotional factors play a role?
Well, your level of education, how well you understand your health and your medications, that's really important for how we teach you about your treatment. We need to explain things in a way that you understand so you can manage your medications safely at home. But we can't just assume things based on, someone's education level, stress, illness, even just the environment you're in. It can all affect how well you learn and remember things. So we have to directly assess your understanding, ask questions, maybe have you explain things back to us.
So really making sure the patient truly gets it, not just assuming. What about their social situation or their finances? How do those fit in?
Yeah, these days people are often discharged from the hospital sooner than they used to be, so it's really important to assess their support system. Who's going to be there to help them with their care, with managing their medications at home? We might even need to connect them with resources in the community if they don't have a strong support system. And financially, the cost of medication can be a big problem. If it's too expensive, people might not be able to take it, and that obviously affects their health. Sometimes there might be a less expensive option, or we can help connect them with programs that offer financial assistance.
So many factors to consider. It really emphasizes that holistic approach. And I'm guessing the way someone typically approaches healthcare matters too.
It does. Do they go for regular checkups or only seek help when it's an emergency? Do they tend to try to treat things themselves first? This all gives us valuable information when we're putting together their teaching plan. It might even hint at things they haven't mentioned, like underlying conditions or other medications they're taking.
Okay, so we've covered a lot of ground on the patient's history. What about the physical exam? What role does that play in assessing someone for drug therapy?
The physical exam helps us identify anything that might be a red flag for using a particular drug, or that might mean we need to use it with extra caution. It also gives us a baseline of their physical health, which lets us track how well the drug is working and if they're having any side effects.
What are some specific physical things a nurse would look at that are particularly important for medication therapy?
Weight is a big one. A lot of standard doses are based on an average adult weight, so if someone is much lighter or heavier, we might need to adjust the dose. Age is another key factor. Kids and older adults often need different doses than younger adults. Their bodies process drugs differently, especially the liver and kidneys. For kids, their developmental stage matters too. Can they swallow pills? Can they understand directions? Older adults, well, they have normal age-related changes like reduced blood flow, slower metabolism, and changes in how their body responds to meds. They're also more likely to be on multiple medications, which increases the risk of interactions, and they might have trouble swallowing.
Makes sense. So many things change as we age. Are there any other physical assessments that are especially important?
It really depends on the specific condition being treated and what the expected effects of the medication are, both the good ones, the therapeutic effects, and any potential side effects. So, for example, if someone has a lung condition and they're taking a medication to help them breathe, we're going to pay very close attention to their breathing rate, their oxygen levels, all that, before, during, and after giving the medication. Nurses are often the ones with the most frequent contact with patients, so we're in a good position to pick up on subtle changes that might mean a drug is working well or that there's a problem brewing.
Okay, so we've got this really thorough assessment, and now we move on to the nursing conclusion, right? What exactly is that?
Right. The nursing conclusion is basically a statement from our perspective about what's going on with the patient. We take all that information from the assessment, analyze it, and identify any actual health problems or potential risks. This then guides us in setting goals and planning what we're going to do, the nursing interventions to address those problems or risks. It's all about understanding how the patient's body is functioning and how that might change based on their overall health situation.
And how does medication therapy specifically fit into this nursing conclusion?
Well, it's important to remember that medication is just one piece of the puzzle. Any conclusions we draw about medication have to be considered alongside all the other health issues and needs of the patient, not just in isolation. It all connects.
The material mentions that the nursing conclusions listed later on mainly focus on potential alterations in function based on the drug's actions. Can you break that down a bit?
Sure. Basically, those examples highlight the potential changes in someone's health that are specifically related to the medication itself. What it's supposed to do, the therapeutic effects, and any possible side effects. While the broader assessment definitely takes into account things like the environment or problems related to the disease itself, the nursing conclusions about the medication often focus more narrowly on how the drug itself might affect the patient's body.
Got it. So we've assessed, we've drawn a conclusion. Now what? Where do we go from there?
The next step is planning. This is where we use the most important information from the nursing conclusion to develop a care plan that's tailored to the individual patient. This involves setting goals, defining the desired outcomes we want to achieve with the medication therapy, making sure it's both safe and effective. For example, a goal might be to reduce a patient's pain by a certain level within a specific time frame, or to get their blood pressure within a target range after starting a new medication.
And when we're talking about medication, what are some typical overall goals?
Generally, we're aiming for an effective response to the medication, meaning it's actually treating the condition it's meant to treat. We also want to minimize any side effects and make sure the patient understands their medication plan and can manage it properly at home.
So it's not just about giving the right dose at the right time. It's about making sure the medication is actually helping the patient and that they can handle it all safely on their own. Okay, so we've got the plan, clear goals. What's next?
Next comes intervention. These are the specific actions we take as nurses to help the patient achieve those goals we set during planning. When it comes to medication, there are three main types of interventions: making sure the drug is administered properly, putting comfort measures in place, and of course, educating the patient and their family.
Okay, let's start with proper drug administration. It sounds simple enough, but I'm guessing it's a bit more involved than just handing someone a pill.
You're right. It actually starts before we even get to the medication itself. We need to carefully evaluate the prescription. A valid prescription needs to have some key information: the patient's full name, the date and time the prescription was written, the name of the medication, the dose, the route of administration, is it by mouth, injection, how often it should be taken, the quantity, any refills allowed, and of course the prescriber's signature.
Okay, so we make sure it's a legitimate order. Then what?
Then comes the really crucial part: following the 8 rights of medication administration. This is like our mental checklist. It's how we prevent errors and ensure the best possible outcomes for the patient. These 8 rights are right patient, right drug, right storage, right route, right dose, right preparation, right timing, and right recording. We'll go into more detail on these later when we talk about preventing medication errors specifically.
Right. The 8 rights, I definitely heard of those. Now, what about comfort measures?
Yeah.
How do nurses help patients feel comfortable when it comes to medication?
We're in a unique position to help patients cope with any effects they might experience from their medications. It's not just about the physical effects either. If someone's more comfortable and any side effects are well managed, they're much more likely to stick with their treatment plan. One interesting aspect is the placebo effect. How much your belief in a treatment can actually influence its effectiveness. So a nurse's attitude, their empathy, their support, it can actually be a part of the therapy. Even a simple word of encouragement can make a difference.
That's amazing. I never really thought about a nurse's emotional support having a direct impact like that.
It really does. And then there's the more direct management of side effects. This could involve things like adjusting the environment, dimming the lights if a medication makes someone sensitive to light, taking safety precautions, like advising them not to drive if a medication causes dizziness, or avoiding too much sun if it increases the risk of sunburn. We might also recommend things like good skincare if a medication causes a rash, strategies to prevent constipation, or eating frequent small meals if someone is nauseous.
And sometimes medications require people to change their daily routines, right? Like pretty big adjustments.
Exactly, and those changes can be tough. For example, if someone's on a diuretic, which increases how much they urinate, they might need to plan their day around being near a bathroom when the medication is most effective. Some osteoporosis medications have very specific instructions, like taking them first thing in the morning on an empty stomach and staying upright afterwards. Some older antidepressants require people to avoid certain foods. These kinds of changes are hard to stick to, so we provide a lot of support, education, and encouragement to help people integrate those changes into their lives.
It's really about understanding that medication isn't just a pill you swallow. It's something that has to fit into your whole life. And the third type of intervention you mentioned was patient and family education. Why is that so important in drug therapy?
It's crucial. Patients are taking on more and more responsibility for their own care at home, so they need the information and skills to manage their medications safely and effectively. In many places, it's actually a legal requirement that patients receive written information about their medications. A good drug education program should cover a lot of ground.
Okay, so what are the key things patients need to know about their medications?
First off, they need to know the name of the drug, the dose, and what it's supposed to do. This is really important if they see multiple healthcare providers. Keeping a written list, or an electronic one, of all their medications and bringing that to appointments, it can be a lifesaver. They should also know exactly when to take the medication, how often, and if it needs to be taken at a specific time, like with meals or on an empty stomach. Any special instructions for storing the medication are important too, like if it needs to be refrigerated or protected from light.
That all seems pretty straightforward, but it's easy to forget the basics when you're feeling overwhelmed. What else is crucial?
Knowing what over-the-counter medications or alternative therapies they should avoid while taking the prescribed medication, those can cause really bad interactions. It's so important for patients to tell their healthcare providers about everything they're taking, even things they buy without a prescription. They also need to know about comfort measures that can help with side effects, like drinking extra fluids if a drug can dehydrate you. And of course, safety measures are key, like keeping medications out of reach of kids, informing all their doctors and other providers about every medication they're taking.
What about warning signs? Are there things patients should watch out for that might signal a problem with the medication?
Definitely. They should know what signs might indicate a serious side effect or a problem with the drug itself, and who to contact if they experience any of those. They should also understand what to do if they can't take their medication for some reason. Some medications can't be stopped suddenly. It can be dangerous. So always contact your healthcare provider before stopping any prescribed medication.
Wow, it's a lot to take in. Sounds like patient education is a big responsibility for nurses.
It really is. We're basically empowering patients to manage their health safely and effectively. It prevents a lot of potential problems down the line.
All right, so we've covered assessment, nursing conclusion, planning, and intervention. That brings us to the last step, evaluation. What's that all about?
Evaluation is an ongoing process. It's not just something we do at the end. It happens throughout the entire care experience. We're constantly checking how the patient is responding to the medication. Is it working? Are they having any side effects? Are there any interactions with other medications, food supplements, or even their lab tests? We're also looking at how effective our nursing interventions and patient education have been.
So it's a continuous cycle of checking and making adjustments as needed.
Exactly. We often go back to the initial assessment and look for any changes. Are things improving? Are there new problems? And then we adjust the nursing interventions accordingly to make sure we're providing the safest and most effective care possible. So if a medication isn't working as well as we hoped, or the side effects are too much, we let the doctor know, and they might change the medication or the overall treatment plan.
Now, the material also talks a lot about medication safety and the risk of errors. Why is this such a big concern?
Well, unfortunately, the risk of medication errors is a significant problem, and it's getting worse. We've got an aging population, more medications available than ever before, and people are spending less time in the hospital, which means more care is happening at home, where there might be less oversight. All of these factors increase the chances of errors happening.
The material mentions a report from back in 2000, I think. What did that say about medication errors?
That was the Institute of Medicine report, To Err is Human. And it really brought the issue of medical errors, including medication errors, to the forefront. They estimated that tens of thousands of deaths each year in hospitals were tied to medical errors. And research since then suggests the number is probably even higher now, especially when you consider care outside the hospital. The financial cost is enormous, too. This report was a big wake-up call. It showed that errors can happen at multiple points in the medication process.
And what are those points where errors can happen?
Well, usually there are three main stages: prescribing the medication, which is done by the doctor, dispensing the medication, which is done by the pharmacist, and then administering the medication, which is the nurse's job. Each of these stages should act as a safety check, to catch potential errors before they reach the patient. And often the nurse is the last line of defense, especially right before a medication is given or when someone's about to go home.
So what does a nurse do to ensure medication safety? What are their strategies for preventing errors?
The foundation of medication safety for nurses is consistently and meticulously applying the 8 rights we talked about before. So let's go through each of those, focusing on how they prevent errors.
Okay, let's start with right patient. What are the key steps there?
It's all about verifying the patient's identity, and we use at least two identifiers. Usually this means checking their ID bracelet and asking them to state their name and date of birth. It's really important to avoid asking leading questions like, "Are you Mr. Smith?" Because someone who's confused or can't hear well might just say yes automatically. We want them to actively tell us their information, and then we check it against their ID bracelet. This is also a good time to double check for allergies and make sure they're not taking anything that could interact with the medication we're about to give.
So no cutting corners on patient identification. What about right drug? How do nurses make sure they have the correct medication?
We always carefully compare the medication we're about to give with what's written on the order or prescription. A lot of drug names look or sound alike, which can lead to mix-ups. If there's any doubt, we look it up, clarify with the pharmacist. Never just assume the information is correct, even if it's on the computer or the label. We also try to avoid abbreviations, and if we see one we're not sure about, we clarify it. And lastly, we take a moment to think, does this medication and dose make sense for this patient? If something seems off, we check with the doctor or pharmacist.
So always being cautious, questioning if something seems wrong. And what about right storage? That seems pretty basic, but are there things to watch out for there?
Yeah, some medications have very specific storage needs. Some have to be refrigerated. Others have to be kept away from light. We make sure those guidelines are being followed wherever the medications are stored.
Okay, on to the next. Right route. Why is the route of administration so important?
Well, the route, whether a medication is taken by mouth, injected, given through an IV, put on the skin, it's all carefully determined based on how the drug is formulated and how it's supposed to be absorbed by the body. Sometimes we might suggest a different route if it would be better or more comfortable for the patient. Like if someone can't swallow pills, maybe there's a liquid form. And it's crucial that we know the correct technique for each route. If we're teaching a patient or family member how to give medication at home, we always have them demonstrate the technique back to us just to be sure they've got it right.
Makes sense.
Yeah.
You want to be absolutely sure the medication is being given the way it's supposed to be given. Right dose is next. How do you ensure that part is correct?
We always double check the dose against the label. And if medication doesn't come in the exact dose that's ordered, we do the math to figure out the right amount. It's important to consider things like the patient's weight, body surface area, their kidney function. Those can all affect the dose. And we never assume the computer system or the pharmacy got it right. We're another layer of safety. We also never cut, crush, or chew tablets or open capsules unless we've checked with the pharmacist that it's okay to do so. And we're super careful with decimal points. A dose of 0.5 milligrams could easily be misread as 5 milligrams, which is a huge difference. We write it as 0.5 milligrams, to be clear. And if a dose seems way too high or too low for the patient, we always question it before giving the medication.
Wow, so much attention to detail. It makes you realize how easy it would be for something to go wrong if you weren't incredibly careful. What about right preparation? What goes into that?
Some medications need special prep before they can be given. Some oral medications might need to be crushed or dissolved, and a lot of injectables have to be mixed with a solution or diluted. It's important to know that many oral medications today can't be altered at all. That could change how they're released in the body and make them less effective or even dangerous. We always check the manufacturer's instructions or ask the pharmacist if we're not sure. For topical medications, there might be specific instructions about how to handle them or how to prepare the patient's skin before applying them.
It sounds like nurses need to be walking encyclopedias. So much to remember about each medication. What about right time? Why is the timing so important?
Well, the timing is usually based on how the drug is absorbed and processed by the body. It's pharmacokinetics. We want to make sure the drug reaches and stays at the right level in the body to be effective. The timing might also need to be coordinated with other medications the patient is taking, or with meals, or even with certain body functions, like giving a blood pressure medication when the patient's blood pressure is typically highest. It can be tough to juggle all of that in a busy hospital, but it's important to get it right. And we also educate patients on why the timing is important and give them written instructions or reminders if they need them.
So much to keep track of.
Uh-huh.
And last but not least, right recording. What are the guidelines for documentation when it comes to medication?
The golden rule is to always document right after the medication is given, never before. Legally, if it's not documented, it didn't happen. We include all the details, like the name of the drug, the dose, the route, the time, and the injection site, if applicable. We also encourage patients to keep track of their medications at home, especially if they have a lot of them. It helps prevent confusion and errors.
Okay, so we've covered the 8 rights. a really comprehensive set of guidelines for nurses to follow. But even with all those precautions, errors can still happen, right?
Unfortunately, yes. And that's why it's so important to emphasize that patients play a vital role in preventing errors, too. They're the ones who know exactly what they're taking and how they're feeling.
So how can patients be more proactive about their medication safety? What can they do?
They should feel empowered to speak up, to ask questions if something isn't clear or doesn't seem right. There are also specific things they can do at home to minimize their risk.
Like what? What are some things nurses should be telling their patients about managing medications at home?
Keeping a list of all their medications, both prescription and over-the-counter, even herbs and supplements, and carrying that list with them. They should also know what each medication is for, why they're taking it. It's important to read those labels carefully and follow the directions, paying attention to when and how to take the medication. They can use things like pill boxes or calendars to help stay organized. And of course, store medications safely, out of reach of children, and tell all their healthcare providers about everything they're taking, everything.
The material also mentions specific things to consider with kids and medication errors. What should parents and caregivers know?
Kids can't always tell us what's wrong, and they depend on adults to give them medications correctly. Their bodies handle medications differently, too, and the margin for error is much smaller. So it's vital for parents and caregivers to keep a list of all their child's medications and share it with every healthcare provider. And never, ever give a child an adult medication. Always read those labels super carefully. A lot of over-the-counter meds have the same ingredients in different brands, and the doses for kids are very specific to their weight and age. Use the measuring device that comes with the medication, not a regular spoon from the kitchen. Keep medications locked away, out of reach, and don't call them candy to try to get your child to take them.
Right.
If your child gets worse after starting a new medication, or if they seem to be having any trouble with it, call the doctor right away. And never hesitate to ask questions if you're not sure about something.
So much good advice there. Now, the last thing the material covers is reporting errors when they do happen. Why is that so important?
Reporting errors, both within hospitals and at a national level, is crucial for learning from mistakes and preventing future ones. National programs, like the ones run by the U.S. Pharmacopoeia, collect data on errors from across the country. This data helps identify common causes of errors so they can issue warnings and recommendations to healthcare providers. For example, sometimes a medication name is changed because it's too easily confused with another drug. Within hospitals, having a system for reporting errors helps us figure out where we need to make improvements, whether it's in our systems, policies, or staff training. The goal isn't to place blame, it's to learn and get better. Healthcare professionals should report errors to their hospital and to national programs because that information often gets shared with organizations like the FDA, drug manufacturers, and groups that focus on medication safety.
So it's all about creating a culture of safety, transparency, where everyone's working together to prevent errors and make things better.
Exactly. By sharing information and implementing strategies to prevent errors, we can collectively make a huge difference in medication safety and improve patient outcomes.
Well, this has been a really in-depth look at the nursing process and how crucial it is for making sure medications are used safely and effectively. It's clearly a complex and ever-changing process that requires constant vigilance from everyone involved in patient care.
It really is. It's a continuous cycle, always adapting to the patient's needs.
So as we wrap up here, thinking about everything we've discussed, all the potential for errors and the vital role of the nursing process in preventing those errors, it really begs the question, what do you think is the most important thing we can do to improve medication safety? Is it about improving communication, empowering patients to be more involved, or maybe using technology more effectively to prevent errors? What do you think?
Those are both really important points. And honestly, making medication safer is going to take a multifaceted approach. But if I had to pick one area to focus on, I'd say it's creating a culture of open communication, where everyone feels comfortable speaking up and sharing responsibility. When everyone feels empowered to ask questions, raise concerns, and actively participate in the medication process, and when we use the nursing process as our guide, I think we can make huge strides in preventing errors and improving patient outcomes.
It's all about working together, being vigilant, and never losing sight of the patient at the center of it all. Great insights, and thanks for joining us for this deep dive.
My pleasure. Thanks for having me.